Let's move on now. Nigeria has entered the fourth wave of the COVID-19 pandemic, and the number of new cases reported by the Nigeria Center for Disease Control are on the rise. The NCDC has reported 2,123 new cases of COVID-19, taking the country's total number of confirmed cases to 227,378. Lagos recorded the highest number with 1,552 new infections, followed by the Federal Capital Territory with 197 and Edo with 155 new cases. Other states with high number of new cases are Rivers with 81, Delta with 44, Plateau with 33, and Kwara with 30 new cases. So far, 211,761 people have been discharged, while 2,989 people have died from COVID-19 related complications. The figures are expected to continue rising due to increased human activity and interactions as Nigerians prepare for Christmas. Joining me now is public health physician Dr. Tui Mebawandu. Good morning. Compliments of the season.
Compliment of the season. Yes.
Now we see cases rising, and the government has come out to say that officially we're in the fourth wave. And in recent times, we've seen that a lot of persons have been complaining of malaria, cold, flu, catarrh, and all of it. And it is said that we have had a 500% increase in recent times. And we're wondering, what are the implications as we see these cases rise? What does it imply for a place like Lagos and the country at large?
Thank you. 2 years ago, around this time, the first case of COVID-19 came out of China. All around the world now, 280 million people, more than 5 million deaths. Fortunately, Africa has had quite a low number. About 7 million cases in Africa and about 250,000 deaths. But interestingly, there are two variants of concerns that have been out of Africa. The Beta came out of South Africa. This Omicron also came out of South Africa. And in reality, it's essentially responsible for the spike and the number. 500,000, more than 500-fold increase in the cases. If you look at the figure for Nigeria, as at middle of November, we had barely about 47 cases per day, on average. It went up to 167 cases per day by 6th of December. And by now, we're having more than 1,200 cases per day. So officially, even before now, on another platform, I've said that we have already entered the fourth wave of the... And then, what is the implication? What we're going to see is that, of course, we're going to see more people getting sick. Now, for now, we cannot say whether the Omicron variant is going to lead to more illness, but again, yes, if you have fatality of just 1% in 200 million people, that's 2 million, and then you don't have the health system to tackle that. And then the other thing is that the key issues that you can use to fight the virus, we don't have.
Which are?
One, vaccines.
Right.
We don't have sufficient vaccines. We've just done about 2% of the population of Nigeria, vaccinated. Even the booster is neither here nor there. Secondly, the kind of information that we should really deploy to deal with the COVID, we're not doing sufficient of that. Testing, which is a key instrument, we've just done 3 million tests out of the number of people in Nigeria. So if you look at the response of other countries to this COVID-19, if you look at China set up a policy of zero COVID. What it means is that they are deploying massive testing. They are deploying QR code to check wherever you are, if you are positive or not positive at all, whether you move to, the QR code tells them wherever you are. Then, in addition, they instituted strict face masks. Even the face mask we're using here may not actually protect you when you're in a crowd, and they prevent anybody from getting to crowd. So now you see that's China policy. In America, they're pushing massive vaccination and booster doses. They are campaigning, they are doing massive testing, deploying test materials to everybody possible, and even incentivizing and giving some money to people to go and take the vaccine. That's what. And then if you look at Asia, they also have that massive, even Europe, massive testing, massive immunization, and then campaign. In fact, the campaign in Europe, they have to strategically target people that anti-vaxxers. A lot of them are in Eastern Europe.
Yeah.
The specific message targeting different community, depending on what they're going to listen to. Now, but in Africa, I am yet to see the clear strategy which we want to use to fight the disease. Is it that we're just going to keep talking, keep issuing statements? Is that a strategy? Now we are not vaccinating sufficiently. We don't even have the vaccine. Secondly, we're not testing sufficiently. Right. Thirdly, our communication has a lot of challenge. There are a lot of doubters, anti-vaxxers, conspiracy theorists, all of them all around here. Nice that we heard that Pastor Kumuyi said that, listen, COVID-19 is real. That is the starting point. From COVID-19 being real, what can he again do to ensure that there's uptake in vaccination, there's social distance?
So people like that should come out and begin to speak.
Yes, indeed. There's, because now there's social distance, there's mask. Because for us, look at it, the whole world has given as much as 8.5 billion doses of vaccination, only 10 million in Africa. So we're not actually up there in responding, and I don't know, honestly.
Are we really
I would like to be educated.
Are we driving it? It's the leadership, driving it as it should. I mean, what is the challenge really for Africa?
You see, what happened is that we have actually assumed that, this thing will not touch us now. But we should be careful because, right, we don't want those people to curtail, the pandemic in their country, and then the thing now had in Africa as an endemic disease. This is time to actually move on, start campaigning against any vaccination discrimination or vaccine supply, start even pushing strategic interest to see how we can do non-pharmaceutical intervention, how we can then engage stakeholders to ensure that, we practice what is possible to really beat back this. But
do you think that the weather perhaps might also be contributing to the increase in the cases that we are witnessing?
How can weather contribute to COVID-19? COVID-19 is COVID-19.
Right.
Okay.
Because we
weather
see also
is weather. Now you see, interestingly, in US, 73% of cases of new COVID are due to Omicron variant, 80% in Europe, okay, up more than 80% in South Africa. But even in Nigeria, we don't even know the percentage due to Omicron variant. We just mob everything together and say that both Delta and Omicron are responsible. So it shows that we have a modeled, approach to understanding the perspective. If we don't do that, how well can we then address this challenge?
All right. We must thank you, Public Health Specialist, Dr. Tuyime Bawandu, for your time on the program. Thank you so much for speaking with us.
Thank you for having me.